Hello, my name is Enos and welcome back to my channel. This is Work and Wonder. If this is your first time, please make sure you subscribe to the channel and turn on the notification bell, and anytime I upload a new video, you would be notified and come straight here and take a look at whatever video that I have uploaded. I talk a lot about the mental health, Osce, traveling, Osce, scholarships in general. So make a time to click on the subscription button, and then anytime I upload a video, you can come straight here and take a look at whatever video that I have uploaded. My last video that I uploaded was 1 month ago. I intentionally left this gap to see whether I could get 1K subscribers, and I'm almost there, about 900 and something. So please make sure you share to your friends, and they also come here and subscribe to the channel. So today we are going to continue with the mental health nursing Osce, and today it's not a station that I'll be talking about, but then when I went off, I had a lot of emails and a lot of messages about 1 or 2 queries that people want to know about. So today the questions that I get a lot, that is what I would be addressing. So questions revolving around the mental health Osce. All these questions, I will be addressing them in this particular video. Please also make time. I have a link below which will lead you to my API booklet. I've created some sort of a booklet with some scenarios, with a template for the planning, and then scenarios for implementation as well. Make sure you click on the link below and then you can have access to that. So without wasting much time, let's get straight into today's video. Back. So as I said earlier on, I will be addressing some questions that have come through in the forms of emails and WhatsApp messages and all of that. So the very first question that I'll be addressing is, how many stations do we have in the mental health Osce? The nursing mental health Osce is also 10 stations, just like the adult nursing LD and then the other pathways. Then when it comes to assessment, that is where a lot of people have issues. Most people have been asking me, do we have assessment for dementia? Do we have assessment for schizophrenia? Do we have assessment for schizoaffective? So people are kind of dwelling on the various mental health disorders that we have, and then they are asking me whether in that exam situation you could have an assessment on that. This, I'm going to refer you back to the NMC website and then the various accredited Osce centers website. When you go on their website, as you can see on your screen, just navigate to the documents that you need for the mental health. Just navigate to the mental health section, and then they have broken it down and what goes into each of the stations. So when we go down to the assessment of the MH, which is a mental health Osce, you can clearly see that it is the assessment is on depression and suicidal ideation, and then bipolar. I know that sometimes it can be a bit confusing, because when we say bipolar, it could be either mania or it could be depression. But most times in the exam situation, when they refer to bipolar, it is going to be much of mania, because we already have a phase that captures for depression and suicidal ideation. But one thing you should also know is that when it comes to the bipolar, which is the depression and the mania, most especially the mania, they are going to be presenting with some manic symptoms. With the manic symptoms, sometimes there could be some bit of symptoms of psychosis, mainly delusions. So this is something that you should also take into consideration. So for us, it's just about mania, doesn't mean that the person is just going to be presenting with manic symptoms. Sometimes there could be some delusions in there as well. So that is what you should take note of. So it is either depression and suicidal ideation and bipolar phase. So these are the 2 phases that you should learn. So there's nothing like dementia, there's nothing like schizophrenia. So you have to take note of it. And another question I also get a lot is, do we do physiological ops in the assessment? No. It's an absolute no. We do not do physiological ops as part of the assessment station. Physiological ops is a whole station on its own in the skill station. So please take note. That is for the assessment station. I've had a lot of these questions around that. Then let's go to the planning station. One of the questions is the planning linked to the assessment? Yes, it is. It's linked to the assessment because based on the planning, based on the assessment that you do, you are going to come up with risk factors and then problems. Then you prioritize these problems and you use two of them, and then you draw a care plan. That will lead me to my next question, which is how many care plans do we have or do we do in the planning stage? It is two. So you choose two problems that you were able to get from your assessment, you prioritize them, and then you can use these two problems to draw your care plan. Now let's move on to the implementation station. Most people have been asking me, is it only psychotropic medications that you would be administering? Is it only psychotropic medications that you'll be administering? Of course, mental health patients or people who are suffering from mental health do not only take psychotropic medication. Some of them may also have some physical health issues like diabetes, like hypertension. And not only that, the risks with regards to some psychotropic medications. Some will make patients put on weight. Some it's going to cause a whole lot of twitching and all of that. So most of the times psychotropic medications goes along with some other medications, even with vitamins, vitamin D for instance. These are medications that you find most mental health patients on. So don't expect in exam situation that you are only going to be giving psychotropic medications, the antipsychotics and all of that. No. So you should expect more, not just medications that are used in mental health. Now, how many medication would I be serving? This is a question that I've been getting a lot. How many medications? As many as the examiners wish, or as many as the NMC wish. If they wish you to serve 10 medications, you are going to serve 10. If it is 20, it's 20. If it is 30, it's 30. So just make sure that you acquaint yourself with the various psychotropic medications and other physical health medications that are mainly or that are mostly used in the mental health setting. Then what medications would I be serving specifically? Here you can be given. So Faras, it falls under psychotropic. So Faras is a medication that is used in the mental health setting. You would be using it. So just take note of this as well. Now, the last part of the API, which is evaluation. Most people have always told me that they have issues when it comes to the assessment area, which is this. We have the situation, the background, the assessment, and then recommendations. Under the evaluation, the assessment area is where a lot of people have issues. I have a video on that, and it will be tagged somewhere along here. Just click on it and then you can look at how I did the assessment bit of the S bar. Now let's go to the skill station. The skill station, we just have 6 skill stations in the mental health nursing Osce, which is a physiological or suppository administration, nutritional assessment. These the way you can also find in adult nursing and other pathways. But then de-escalation, reminiscence therapy, and talking therapy. This is ones that are very, very, very specific to mental health, and they are not difficult. So out of these 6, you'll be doing 4. So these are this is what you need to know about the skill station. So many people have asked me, how do we give insulin administration and all of that? All those are adult nursing. So when you are learning, please make sure that you skill your learning to these 6 skill stations. And out of these 6, you know definitely that you would be getting 4 out of these 6, which should be more than easy for you to pass, because all these skill stations are not difficult anyway. And then for the professional values and then the evidence-based, I've not had much questions on that. The only question I get is, do I need to read all the topics that they have given under both evidence-based and then professional values? Yes, because any of them at all is a potential question that you can get, or a potential scenario that you can get in the exam situation. So please make sure that you read the marking criteria right from topic 1 to the 14th topic for the evidence-based, and the same also for the professional values, and then you'll be more than good to pass your exams on your first attempt. So yes, these are some of the questions that I do get a lot with regards to the mental health Osce, and I believe I have answered most of the questions that most of you have been asking via my email and then my WhatsApp line, and even under the comment section. So yeah, that's the video for today, and please make sure you subscribe to the channel. We are almost getting to 1,000 subscribers. Please make sure you subscribe and also share to other people for them to subscribe. And then there are more videos that I'm yet to upload, and those that have also been asking for materials. As I said, there is a link in the description. When you click on it, it's going to lead you to a place where you can get. I've put more like a booklet together for the API with scenarios in the assessment, and then the planning to. I have done like a template. You can go through it. With the implementation, I also have scenarios, and then the evaluation, I also have a scenario. So make sure you click on the link below and you can have access to that. Until we meet again, it's a bye for now. My name is Enos, and this is Work and Wonder.